Thank you very much, Mayor. We are seeing a continued increase in the case counts of the coronavirus infection here in Philadelphia, which signals that we may be entering a dangerous period with this virus. Here are the numbers. Since this time yesterday, we've identified 268 new cases confirmed with the coronavirus infection in Philadelphia residents. That's confirmed with a PCR test, the regular test, bringing us to a total of 40,704 since the beginning of the epidemic. Now, in addition to that, we've had 23 new probable cases diagnosed by a rapid antigen test only. Now, for the past week, between October 4th and October 10th, we averaged 189 cases per day. That's so far, because that data is incomplete. There's always some laboratories that report their data to us some numbers of days later, and so that average is likely to increase in the next few days. Now, for the previous week, from September 27th to October 3rd, we averaged 184 cases per day. These are the highest weekly averages that we've seen in Philadelphia since mid-May. Now, those high case counts are in part because we're doing more testing. We did an average of about 4,000 tests per day in the past week. And for comparison, we did about 2,600 tests per day in the middle of July and about 1,500 tests per day in May. But the percent of tests that are positive is also increasing. Last week, we averaged 4.8% of the tests that were positive so far. Now, we know we have delayed reporting from laboratories that report the positives to us only. So as we get delayed reports, that percent positive is going to increase as well. The week before last, from September 27th to October 4th, we were at 5.1% positive. A week ago, I reported that as 4.3% positive, but you can see that that percent increased with delayed reporting. For comparison to that 4.8% or 5.1%, the low point for our percent positive occurred in mid-September when we were at 2.8% positive. In mid-July, when we had a peak for the summer, we were at 5.5% positive. And in late May, we were at 9.5% positive. That's what's happening with cases. With deaths so far, we have 8 newly identified since yesterday, bringing us to a total of 1,849 since the beginning of the epidemic. We're still averaging about 15 deaths per week. So far, we're not seeing an increase in deaths associated with the increase in cases. We do know that deaths tend to lag behind, so we expect that we will see some deaths in the future related to this increase. So where is this spread occurring in Philadelphia? In the past week, it was more in Northeast Philadelphia and in South Philadelphia. But in the last 7 days or so, we're seeing more in all the zip codes across the city. There's no neighborhood that has not seen an increase in recent days. Our information from case interviews as part of our contact tracing is showing that the spread is occurring within households and in social gatherings. That's family gatherings, it's people visiting each other's houses, that's weddings, it's bridal showers. The case interviews, though, were also showing an increasing percentage of the cases who reported that they were working in an office during the time period when they were exposed. It was 17% of our cases that we interviewed reported that in the week of October 11th versus about 7 or 9% during the weeks in September. And with that, we've had some individual circumstances where the spread appears to have occurred between coworkers who got together over lunch and were not wearing masks when they were doing that. So it's just a reminder that any setting indoors, when people are close together, not wearing masks, such as the time when they're getting together over lunch, is going to be a high-risk setting. And so workplaces is something we're concerned about right now. Now, beyond that, what's happening in our facilities that we've been watching especially. In nursing homes and other congregate care facilities, we are also seeing more cases in parallel with the increasing cases in the community. So we're going to be communicating to the people working in these congregate care facilities the importance of masking and other safety precautions for staff and patients now. Particularly important that they try to keep the virus from coming into the facility, or if it does get into the facility, to prevent it from spreading from one person to another within the facility. In parallel with that, we have now opened what we're referring to as the COVID relief unit. This is a specialized nursing home set aside to care for nursing home patients who are COVID positive, who have tested positive for COVID, who have been in nursing homes where the nursing homes cannot safely care for them within their main facility. So if that nursing home, for example, can't have a separate wing where the COVID positive residents stay to keep them separate from the negative residents, then they can have them transferred to this COVID relief unit. What about schools? We have been working with schools since the beginning of the school year. There have now been, since the beginning of the year, 44 sites that have seen cases in either students or staff. Now, most of those are isolated cases where there's no evidence of spread within the facility. And some often there's been more than one case. In 26 sites, there have been quarantines that we have recommended or that have been carried out. Often it's maybe one classroom, and nearly all situations, the spread has stopped right there. We however, have one school cluster where the information suggests that there was spread within a classroom. That's the Philadelphia school, independent school. It's had 15 cases so far. But this is the only situation so far where we think that's occurred. Of about 50 schools that we think are providing some amount of in-person education right now for about 7 weeks since the beginning of the epidemic. In all the other situations, we have no clear evidence of spread within a classroom. What about tracking of masks? As you know, we have been doing observations of people using security cameras to see how many Philadelphia residents are wearing masks. We've had a variety of technical problems over the past few weeks getting those observations done, but we are doing them now. We're getting the data back in again. And as of the week that started October 11th, 80% of people that were leaving retail stores were wearing masks. Now that's good at 80%, but it's not good enough. That means it's 20% were not wearing masks. That's still enough to have the spread of the coronavirus. That's what's happening here in Philadelphia. What about what's happening around us? We are seeing an increase in cases across the rest of the state of Pennsylvania, as well as in New Jersey. And in the US as a whole, case rates are clearly rising. At this point, they're not far from the peak that they saw in mid-July, which was the highest case count we had since the beginning of the epidemic. Now, mid-July, the states that had the highest case counts were in the South. Now, the states with the highest case counts and case rates are in the Midwest and in the Mountain West, the northern part of the central part of the country. But case rates are rising in nearly every state in the United States right now. So the overall message now is that the virus here in Philadelphia is spreading within households, it's spreading in family gatherings, it's spreading in social gatherings, and it may be spreading in workplaces. The risk is increasing now, maybe because of the colder weather, maybe because of the drier air, maybe because people are indoors more because of the colder weather, or maybe because people are becoming more complacent, or all those things combined. Whatever, though, it does appear that the virus is following the pattern of other respiratory viruses, like influenza. These viruses tend to get more common throughout the fall, and they peak in January or February. If COVID follows that pattern, we're going to be having a difficult time over the next 3 to 4 months. So what should everyone do about that? First, let me remind everyone that people who can work from home should continue to do so. I'm concerned about the risk in offices. If you can work from home, do that so you can lower your risk. Then everyone, everywhere, needs to maintain wearing masks and keeping a distance from other people. You know, it's been now 7 months since the beginning of the epidemic, and everyone is tired of this virus. Unfortunately, the virus is not tired of us. Back in the spring, when the epidemic first hit, the mayor said, this is a virus that hunts humans. And the reality is, it's still hunting. We need to wear masks until we've vaccinated enough people that the virus has trouble finding people who don't already have antibodies. So everyone needs to wear masks, especially when they're around family, when they're around friends, when they're around coworkers, and when they're around anyone else. So more information on all the epidemic is on www.phila.gov/COVID. Thanks.
Good afternoon. Dr. Farley, you mentioned a number of different environments where you've been tracing the spread, schools, long-term care facilities, places like that. And you did allude to coworkers having lunch, presumably inside a restaurant, but you really didn't talk much about restaurants. And I know there's been a lot of concern about this. Have you seen much spread within the restaurant community, whether workers or people who've been to restaurants?
Actually, when I was talking about coworkers getting together over lunch, I was talking about them getting together over lunch at the workplace, not necessarily at a restaurant.
Okay, well, how about the restaurants?
Right. So right now we have not seen clear evidence of spread at restaurants, and we're not seeing an increasing percentage of our cases reporting having gone to a restaurant. Now, the case investigation interviews are not perfect. That an awful lot of people, we don't know how they got infected, but so far we're not seeing hard evidence. So we might miss some of that, but so far we're not seeing evidence of spread at restaurants.
Got it. And speaking of restaurants, self-appointed public health expert Mark Vetri went to the Eagles game at the Link on Sunday and insists that you could easily double the capacity allowed in the stadium without, in his words, having any kind of problems. If the state allows an increase, would you allow more people to attend the events at the link?
Well, that's a big if. I don't know if the state's going to do that. Let me just say that right now, you looked at the numbers I just reported, our cases are rising. So I'm not so inclined to release restrictions. I'm more inclined to impose new restrictions to try to prevent more people from getting infected and more people from dying.
Great segue into my last quick question, which is, the numbers are increasing. We're hearing lots of things from different experts around the country about how we're 3 weeks, two weeks behind Europe, how it's going to be very difficult next few months. What about new restrictions? Should we not be waiting for the state to do things? Can we not be a model for other cities and impose newer, stricter restrictions instead of responding 2 weeks from now when the numbers could be going out of control?
Well, we are more restricted than the state in a number of areas, such as gatherings, indoor gatherings in particular. I would just say where we have evidence of spread, then we will see if it makes sense to put in place additional restrictions. So you heard me today that we do have, looks like perhaps new evidence of spread at workplaces. And at least we are recommending or reminding people of our recommendation that they should work from home if they could. But if right now most of the spread appears to be occurring more in private houses and places that would not be under the control of our restrictions. It's not clear what additional restrictions we should put in place right now, but we are watching this very closely. And if we feel like we can make a difference in prevention with restrictions, we will look seriously at doing that.
Thank you so much.
Thanks, Victor. We're going to go to Mitch Blocker now of NBC 10.
Dr. Farley, how does the spike that we're seeing right now compare to the previous two? And I'm wondering, where do you think this third spike tops out?
I'm going to be very careful not to make predictions because I made it in the past and I've been wrong. But certainly, as I said earlier, if the virus follows the pattern of other respiratory viruses, it would get worse over the next few months and peak around January or February. I can say is where we are now relative to past. As far as the percent positive, which might be a more accurate measure overall, we're about where we were in mid-July. Not as bad as we were in May. But as I said, it very well could get worse from here.
And you talked about the Philadelphia school. A school with the means of the Philadelphia school, tuition is about $30,000 a year. If a school with means and resources can't necessarily prevent an outbreak, what does that mean for the future of public schools, in your opinion?
Well, we still feel that public schools can open safely. We do think that it makes a huge difference if all safety measures are followed. Now, we don't know what happened at that one particular school. There may have been one slip in technique. But I try to put it in context. Again, we have now some 50 schools in the city that have been doing this for 7 weeks, and that's the only school out of that 50 where we have any evidence to suggest they're spread within a classroom. So I'm hopeful that there was some slip up there that is not a consistent slip up. And I'm still feeling that the school system, if they follow safety precautions, can do so safely.
And one last question, kind of a bottom line question. Do you believe that it is safe for kids to be in school in person? And can you explain a little bit what you have to consider when you make that calculation? I
think if people are wearing masks in particular, but also doing other safety procedures, that it's safe for them to get together. Now, there's a lot of other safety procedures that need to be followed. I also think that it's important for children to be in school for their long-term health and their short-term mental health. Having talked to some people who've had their children back in school, they say that children's mental health has brightened up tremendously with getting back to school. We have a lot of other health problems in this city, right, and up to homicides, and having children not in schools, having teenagers not in schools doesn't help those other problems. So I think it is important for us to try to make it work in schools to address those other problems. And I think if they're really vigilant about safety measures, they can do so safely.
Hey, thank you, sir.
Thanks, Mitch. We're going to go now to Laura McChrystal of the Inquirer.
Hi. First, just a quick clarification, Dr. Farley, you mentioned the case count for the last week. you referenced that as October 4th to 10th, which actually would have been 2 weeks ago. So which dates, were those indeed the dates you were talking about?
I've got my dates mixed up. I apologize for that. The numbers I gave you were correct numbers, but I had the dates mixed up. So the past week, which would have ended on what, the 17th? Is Saturday 17th?
Yes.
Yes. All right. So that was 189 cases per day for the week ending October 17th, and 184 cases per day for the week ending October 10th. My apologies for that.
No problem. Thank you for clarifying. And Dr. Farley, I'm wondering, you mentioned that you're still seeing spread in social gatherings as the biggest thing. That's kind of been the case all along. So I'm wondering, do you think more people are having social gatherings? Is that the problem? And how do you convince people to not do that?
We have heard of gatherings that people had postponed from months before when the epidemic was worse, and they've said, well, okay, things are when they had it now, and maybe some COVID fatigue setting in. And I'm not sure how we do that other than to continue to drive home the message that the risk is high now. If anything, is higher now than it was a month or so ago, and encourage people to wear masks. That people are not as afraid of the virus now as they were before, but the virus is just as deadly now as it was before.
Okay. And my last question, the COVID relief unit for nursing homes, where is that unit located, and do you have anyone admitted to it already?
We do have one patient admitted to that facility. And I think I was asked that question last week, and I said I wanted to not name the particular facility because I didn't want people to be poking around that facility. But it's an unused floor of a nursing home here in the city. We have taken over for this.
Okay, thank you.
Thanks, Laura. We're going to go now to Nina Feldman with WHYY.
Hello. Just a quick follow-up on the COVID relief unit. You said it's an unused floor of a nursing home in the city. Are the other floors in use for non-COVID?
Are in use. They are, yes.
They are in use.
Yes.
Okay. And kind of going back to the question about the unregulatable small social gatherings, I wonder, I think you're absolutely right. There's COVID fatigue. We've been at this for 7 months. I wonder if the city has thought about kind of any sort of messaging or strategies for almost like a harm reduction perspective for these gatherings. Like, people are going to do them. People are clearly doing them, and telling people to stay home doesn't seem like it's working anymore because people are sick of staying home. And so I wonder if the city has thought about any sort of ways that aren't sort of like an abstinence only approach of don't go out, but ways to do it safely. Obviously, masks are one thing you could think about in that, but if there are other kind of ways to mitigate risk with the understanding that people are going to go out because they can't really bear not to anymore.
Well, I don't want to make it sound like people are having as many social gatherings as they would have had this epidemic not occurred or we not had a messaging. I do think we have reduced the number of social gatherings that are take place. We just haven't reduced them low enough to prevent total spread of the virus. And what we are doing, which is part of our restrictions, is have much looser restrictions outdoors and indoors. We've been explicit. They've said, if you want to get together with people and you feel like you need to get together with people, do it outdoors, because there's good evidence that the risk outdoors is much less than the risk indoors.
Okay. And my last question is, you mentioned that the coworkers eating together in an office space, you want to make it clear that that's a high risk activity. Would you classify indoor dining as a high risk activity?
Indoor dining absolutely is a high risk activity. And there some very strict procedures that restaurants need to follow to reduce the risk in a restaurant. Among them, the tables can be no more than 4 persons at a table, and that really should be a household group. And there needs to be at least 6 feet between people sitting at one table and people sitting at another table to try to prevent spread between household groups there. And then there are other protections for the servers, et cetera. So indoor dining is absolutely high risk. We put in place strict safety procedures. So far, we don't have evidence that it's spreading in restaurants. If we do, though, then we will consider whether we want to restrict them further.
Okay, thank you.
Thanks, Nina. We're going to move to Jeff Chirico now of 6ABC.
Share any trends on the ages of the new cases. Is this trending younger than perhaps it did in the spring? Is it a sign perhaps that seniors are taking this more seriously and social distancing better?
This is trending younger than it did in the spring. So a lower percentage of people are over the age of 60. However, it's not as young as we had in late August. In late August, when the college students came back, we had a spike, and it was very limited to the college age group. In the past month, it's not been limited to the college age group. It's more people ages 20 to 50 or even 20 to 60. So it's getting people old enough that some of those people may become seriously ill.
And what about the hospitals right now? Our capacity is strong, and is that? I mean, I think we're talking about this fatigue. People are saying, "Oh, the hospitals aren't overwhelmed. Maybe this isn't as bad as it was in the spring." And what's our capacity, and what do you say to that?
Well, the hospitals in the city are pretty full right now, but mainly with people that are not having COVID, people with other problems. Many of those may be having elective surgery that was postponed in an early part of the epidemic. And the hospitals do have the ability to clear out space by canceling elective surgeries if they need that space. They have a fairly low number of patients in the hospitals right now. That low number is increasing, and they're watching that. And they will take action, and we'll be talking to them about taking action if they feel like they need to do things in order to make sure that there's adequate space.
All right. And regarding restaurants, I can only imagine that it is difficult to contact trace in restaurants because people are in and out, perhaps no names or check-in. And so could that be a reason why you're not seeing any sort of spread? And perhaps the mayor, can you respond? Are you going to be making any changes to the current capacity levels as we go into these coming months at the restaurant?
Well, I take the recommendations of the health department and Dr. Farley, so I don't freelance with those issues. So I think he'd be better off answering the question.
Okay.
As to the first part of the question, our contact tracing is definitely a far from perfect system to find out where the virus is spreading. A lot of people may not know. We may not get them on the phone. They may not be fully forthright about everything that they did during the period when they might have become infected. However, the people who become infected that we interviewed, it's a very low percentage that are saying that they ate out at a restaurant during the time period when they might have been exposed. If that percentage increases, just as the percent of people at workplaces increased, then you will hear about it, and we'll see whether we need to do something different when restaurants.
All right. Thank you very much.
Thanks, Jeff. We're going to go now to Michaela Winberg of Billy Penn.
Hey, everyone. I have a couple questions for Dr. Farley about nursing homes, actually, since you brought it up earlier. I'm wondering if, by your estimation, most nursing homes in the city are still restricting or prohibiting visitation altogether.
That is regulated by the state at this point, and so I don't have data on that. I think most nursing homes are restricting visitors to some degree. I don't know whether all of them to completely.
Okay. And in terms of balancing visitation and letting residents out with the pandemic and election day coming up, do you have any recommendations for how nursing homes handle that? Are there citywide recommendations you would issue?
We have not issued recommendations for the nursing home residents to be able to vote safely.
Yes, exactly.
I would probably suggest that the best thing they should do is vote by mail. And if they're not going to vote by mail, then they need to be using a very careful PPE when they go to the polling place.
And do you have any recommendations for the facilities, how they sort of manage this? Do you think they should be allowing visitors to help deliver ballots or should be allowing residents to go vote in person?
No, we actually haven't thought about that. And let me think about that. I definitely think that the facilities should be careful about that. They want to enable voting, but they need to enable it in a safe way. So let me think about that and give you a response later.
Sure. Thank you. That's all.
Thanks, Michaela. We're going to move now to Kennedy Rose of the Philadelphia Business Journal.
Hi, I have a few questions for Dr. Farley. I was wondering first if you were able to provide any more detail on cases that have spread through offices, such as the number of cases you've seen or sort of any other circumstances beyond people eating together at lunch.
Really, all the information I have is what I already reported. And we get those from our case interviews when we're doing the contact tracing. And we don't get every case on the phone, and not all of them will give us full information. And so we just have that percentage of those cases that are reporting having been in an office, and we did see an increase in that. And then we've had some of these anecdotes where we hear that people got together over lunch to use masks, and that seemed like a logical situation in which that spread was occurring. Put those two together, that suggests that there may be some spread occurring in workplaces.
Okay, and are you able to provide the percentage of people who, through your contact tracing interviews, said that they were working in an office? Do you have that percentage number?
Yeah, it was 17% for last week. Let me make sure I get the date correctly because I made my other date wrong. But the last data point I have was 17%, and in September we were running between 7 and 9%.
Gotcha. Okay, and are you seeing larger contingencies of employees? Do you know if they work in sort of larger offices, or are these more people who say that they work in smaller offices with fewer people?
Yeah, we don't have that level of detail.
Okay, thanks very much.
Thank you, Kennedy. We are going to go to Argenis Figueroa with Univision.
Okay, good afternoon.
Buenas tardes, Argenis.
Buenas tardes, Armando. Gracias. Armando, mi pregunta es para el doctor Farley. Quiero que nos diga si estamos ya en una segunda ola de contagios en Filadelfia. ¿Cuál es el estatus actual de esta preocupación?
Dr. Farley, the question is for you. We wonder if we're entering the second wave of contagious phase in this pandemic, and what is your concerns about it?
I'm concerned that we may be entering a fall-winter wave, and my concern is that if this virus follows the same pattern of other respiratory viruses, it will continue to get worse through January or February.
Tengo la preocupación de que efectivamente este virus está entrando en un ciclo durante el otoño y el invierno que observa el mismo patrón de otros virus respiratorios que hemos tenido, que podamos haber entrado o estemos entrando en una nueva fase.
Ok, y mi segunda pregunta sería si la tendencia del virus sigue en aumento, ¿consideran hacer pausa en escuelas, en restaurantes o actividades en general, como lo han hecho otras ciudades?
My second question has to deal with what would be the response of the city if the trend on this virus keeps on going back up. Will there be a stop to activities in schools, restaurants, and other activities as other cities have done?
We're going to look at settings in which we believe the virus may be spreading. And if we identify a setting that we feel it's spreading and that we can prevent that spread through further restrictions, then we'll look seriously at those restrictions.
Vamos a ver los entornos en los cuales creemos que este virus pudiera estar propagándose, y si identificamos esos entornos, entonces podemos traer unas medidas más severas de restricción para impedir.
Muchas gracias, Armando. Todo.
Thank you very much.
Thank you, Argenis. We're going to go now to Manny Smith of CBS 3.
All right, there we go. Thank you. All right, two questions for Dr. Farley. You said that you weren't able to provide more specifics on the cases that were spreading at offices. What about like work-based policies or whatever? I know the city is, was considering about bringing more people back to work, or are you giving advice to other offices who are considering about bringing more people in, given the rise in cases in workplaces?
Right. What I'm saying today, and that's part of what our message is that people who can work from home should work from home. I'm concerned about what may be happening in offices right now, given the rising rates. If people can work from home, they should do so.
Would that concern extend to like mass transit or people going back and forth to work?
I think mass transit workers should work so people can get around. There are people who do need to get around.
No, I meant like people going to work, like using the bus or train to get to work.
Well, if they can work from home, then they wouldn't be taking the bus. They wouldn't be using mass transit. And to the extent there's a risk there, that would reduce that risk as well.
All right. And then my last question in the same vein is that, in about 2 weeks' time, everybody's going to be going to vote, or a lot of people will be going to go vote in person. So you got a number of poll workers and people potentially standing around in election lines. Is there concern for people participating in that activity?
Yes, and we are making recommendations to the city commissioners about safety procedures that could be done at polling places so people can vote safely.
What are some of those procedures?
Everybody should be wearing a mask. There should be at least 6 feet between people. There can be a limit to how many people are allowed in the polling place indoors at any one time, so people are more likely to have to wait outdoors, and a limited amount of time that people spend indoors for the time that they vote.
All right, thank you very much.
Thanks, Manny. We're going to go now to Pat Loeb of KYW News Radio.
Yes, my question is for Dr. Farley. People who are experiencing incarceration, were they included in the numbers of COVID cases?
Yes.
And has there been an increase?
I don't have those numbers for you. If there has been, it's been small.
Hey, thanks. This is actually still a pandemic-related question, but just one more question related to contact tracing. Is Dr. Farley still here, actually?
I'm still here, yep.
Okay, great. Can you just describe I know that in a perfect world, everybody who contracts or tests positive for the virus would get a call from a contact tracer, but in the event that somebody got missed or skipped over accidentally, what should somebody do if they don't get contacted by a contact tracer and they want to help the process along?
They should, again, we're trying to reach everybody, but given the very large increase in cases, we're not going to reach everyone, and not everyone picks up the phone. And so if they don't get a call from us, then they should identify every person who they spent more than 15 minutes with, let's say within 6 feet, during the period when they might have been infectious. And that is, I'm going to blank on the time period, but let's say, from the time that 48 hours before they develop symptoms until they learn their result and are separated from people. Then tell all those people that they should go into quarantine, and they should quarantine for 14 days and ideally be tested around 7 days.
Okay, so essentially they should do the contact tracing themselves.
Yes, I mean, again, we try to do that with everyone, but we're not going to catch up with everyone. So if we can't, then them notifying their contacts is at least something that's useful to potentially stop the chain of spread.
Got it. And the contact tracers call once, and if there's no answer, do they leave a message? Do they call again? What's that?
They call repeatedly, and they try it at different times, and they may try 2 calls right away on the assumption that sometimes people just don't pick up the phone the first time because they think it's a telemarketer. So we do make a lot of effort to reach people.